Hello everyone, in this video I will talk to you about how to search for a clinical attachment by using Google Map. So open Google Map, then type in any city in England. Here as you see this is England. There are many cities. Let's start with Bristol. Okay, as you see there are many hospitals. When you type in Bristol hospitals, as you see in the here, it's Bristol hospitals search. There are many hospitals as a result of the search. Click on any one of them, okay, and I either go to any of them because most of them follow the same trust. So search all of them just to see if they are following a different trust than each other, because if they are following different trusts, then you need to communicate with those two trusts. If it's the same trust, they all these hospitals follow the same headquarters, follow the same guidelines. The same human resources are responsible for all of them. So just send to one of these your qualifications and contact only one time. You don't need to contact every single hospital because they are all as work as one group. Okay. Let's choose here the highest reviewed one, might be the biggest one. Okay, and open the website here. So before going to the website, there in Google Map it provide, as you see, call. This means the phone number of this hospital. Who will answer you is the switchboard. You can ask the switchboard to connect you to the human resources or the department which you want um, to talk to ask them to for observership. Put in your mind the switchboard personnel does not know anything about observerships, anything about program. Say who you are, what do you want, and or say I want to talk to human resource. I want to talk to this department secretary or assistant, or any assistant of any consultant in this department. The switchboard personnel does not know anything about what you want, about what does it mean. Okay, so he just connect people to uh, departments or office. Now let's move to the next point, which is a website. Okay, it's opening right now. Okay. Okay, as you see here in the upper part of this page, in the top left corner, in North Bristol NHS Trust. Okay, South Mid Hospital Bristol. Our hospital is okay. Speaking about only South Mid. Okay. All right. Our hospital. See, you are here, home. Our hospitals, South Hospital. So if you want to know which hospitals are involved under the same one group trust, click on our hospital. See, so South Mid Hospital Bristol, Cosham Hospital, Bristol Center for Enablement, French, I think, as you see here. Okay, so let's search in South Mid Hospital. Okay, how to search for search here in this website? You have two things to always look for: the browser, this magnifying lens icon. Type in clinical attachment or clinical observership, okay, or observership. Sometimes you will find results. Just go through with these results. You will find contacts and certain personnel in charge of this observership programs. If you did not find any contacts after you used the browser for clinical attachment or clinical observership, this is not the end of it. I mean, end of this website search. You can open here in the upper right corner. There is 3 dash under each other. Open these dashes. Here, you have a list of a few things you need to look for. So our services mean the department and the specialties in this hospital. Some hospital doesn't have ophthalmology. Some hospitals doesn't have a certain service. Other hospitals have it. Okay, so in order for you to know which department, which is, specialties are in this hospital. So click on our services, A to Z of services. See here, abdominal arcing and user screening, problem accident emergency, acute surgery, acute medicine unit, acute oncology service, anesthetics, audiology. Okay, let's take O. Let's see if they have occupational therapy, orthopedics, emergency, orthopedic plan, osteoporosis, outlook, outpatients, orthotics. Though they don't have ophthalmology. Okay, maybe they have it in E as I. E. They do not have I either. Okay, anything with A, nothing. Emergencies on electronic, early pregnancy, end of life care, endocrine. Okay, so these are the services inside this hospital. Okay, so let's pretend we are looking for an observership in general surgery or acute surgery. Let's click on this service. Okay, during acute surgery, atmosphere treat patients with a range of general. Okay, our hospital can outpatient ear failure. Our services general. Okay, sometime you will find contacts for this department. The assistant or secretary of the head of the department might leave their contacts here. Okay, and sometimes they put the list of the consultants on the website. Some of these consultants put their email or their assistant email or their contact on the website. Um, yes, so don't expect you'll always find everything just in front of you, but keep looking, okay? But definitely you will find someone to answer you, okay? Um, let's try another specialty. Let's see. Okay. Let's see gynecology, gastroenterology, and liver medicine. Okay. Medicine outpatients. Here. Outpatients, inpatients, tests, gastroenterology liver team, patient information for clinicians. Let's see this link. Gastroenterology and hepatology for clinicians. How to referral criteria, care pathways. Okay. Okay. Still no contacts. Okay. So this way, as I showed you, when you click on the menu, you'll find our services. And from these services, you'll find what specialties or departments is in this hospital. Okay? You will contact these departments if you find any contacts they put on the website. If not, still there is hope. So you will type in the search box human resources. Okay. Sometimes when you type in human resources, their contacts and the information just appear in front of you. Okay. All right. Still there is no result. Okay. So there is still hope. Open here is a menu again. So we checked our services. We tried the browser to find contacts for the human resources, education. There, in many hospitals, there are education centers. These education centers, you can contact them for so many courses they provide, for lab skills they provide. You can practice there your hand skills. Um, they have e-learning, as you see, some courses online. Also, in education centers, they provide observership programs, teaching sessions. Um, it's very helpful. Just put it in, put a pen on it, and think about it later on. Learning and development. That what we assist with all these. That's the service that we assist with. Here you found contacts. You found contacts here. Undergraduate, staff development, postgraduates, undergraduates, library. It says clinical skills, as I told you, they provide teaching and development in your skills. Room booking inquiries. I don't know what is that. Learning and development. Okay, we have checked that list. You are very proud of this list. They just put it twice in the same page. Okay, fine. So you have contacts here for the education center. Contact them. Ask for what you want to ask. They will either respond to you if they are entitled to whatever you ask for about that, or ask them for the human resources, because the human resources should direct you to the right direction, where you should ask, what you should, who you should talk to. Sometimes the consultants are busy, they will not respond always to your emails, but they can ask the secretary or the assistant, their assistant. They always has assistants, many of, a few of them, they are quite busy. Okay, so that's first thing you got from uh, this website here. Found some contacts of the education center. Okay, support us, research, clinicians, careers. Okay, let's see what careers offer. Maybe they have something. That's the upcoming event. Explore nursing and the career. Okay, careers, current vacancies. If you're looking for a job, they might have vacancies, and let's see what they have here. Nursing, midwife, medical and dental, allied health professionals, science service, support service, administrative service, apprenticeship. Let's click on any of the medical and dental. Consultant anesthetist. See, they are looking for a consultant, okay? Junior clinical fellow in stroke. Consultant, clinical fellow in brain injuries, T1, ST, junior clinical fellow. Clinical fellow is T1, 2, robotic pelvic oncology, fixed term consultant emergency. Clinical fellow, specialist doctor, clinical fellow. Okay, these are the vacancies there. By the way, I want to bring your attention or your knowledge towards something called medical supporter. It doesn't need full GMC registration. It doesn't need registration at all, and they can offer you a job and get money out of it in order for you to continue your studies or plan. As you anyway, you are getting to GMC registration to work there. So if they liked you in your observership, and if you still didn't pass your PLAB 2, they can still give you a job. They like you, and if you asked about it, like medical supporter or healthcare assistant. Let's see allied health and professionals, radiographer, junior physiotherapist, medicine radiographer, occupational therapist, patient therapist. These need qualifications. Healthcare service, special scientific trainee, special biomedical scientist, biomedical and pharmacy assistant, band 2, special pharmacy technician. Okay, support services, logistic and distribution team leader, chef, band, domestic assistant, housekeeper, band, domestic, bank, reporting operative, bank catering operative. Okay, administrative services. waiting list coordinator, central administrator, central any logistic healthcare support. This is one. Apprenticeship, healthcare support worker. Okay. Yeah, this job sometimes people get it. Full-time part-time. Doesn't need qualifications. So feel free to try to apply for these jobs if even if you didn't get your full GMC registration. Okay, back to our talk, which is looking for observership. So we opened we reached to the vacancies from the menu when we we clicked on careers. Okay, so going back to the menu in order to check other, we are looking for the human resources or contacts for any departments in order for us to contact them. We found in education something in education here, found some contacts. Okay, as I told you, if you call the switchboard right away, ask them for an email or a phone number of the human resources. Um, this is the number. You can get the number from Google Map or this number here, and you will definitely find it on the website. Also, try to click on Contact Us here. Some of these, as you see here in the right list here of directing titles here, feedback under it, Contact Us, and a freedom of information. To click on Contact Us. Eh, okay, so for general inquiries, telephone switchboard on this. Okay, and if they give you the contact of switchboard in all the hospitals inside this trust. Okay. Okay. All right. Telephone numbers. Okay. All right. So that's how you reach to human resources. So we reach it to education, research, clinicians, careers, patient career, our services, our hospitals. Yes, and this is what you can get out of the website. So, all in all, and in brief, in order for you to use a Google Map, right, it is a good way to look for clinical attachments or observership. Search for cities, search for trusts, email the human resources or the consultant or their assistants. Ask for write in the well written email, formal email. Represent yourself. Who are you? What's your level? Then what do you want? Attach your qualifications, your CV, and wait for the reply. That's it. This will, the whole process will not be maybe not as easy as it sounds. They will not respond fast. It will take some time for the consultant to respond, but eventually you will get something. Okay. Some of these observerships are for money, others for free. I haven't found anything for free myself, but other people did. Um, um, what else I want you to know? There are other ways of getting observerships like recommendation. So if someone recommended you for this observership, someone recommended you for this observership, like a friend or a friend close to the people there, liked by the consultants and the people working in the hospital. Eventually, if it's easy, I mean, if he or she did ask the consultant if there is a possibility for this person come, he has qualifications, he's working with your CV, they have already, they can send you can they give the email, the consultant email to that person to email the consultant and ask for observership or clinical attachment. That's a good way of getting observerships and clinical attachment. That's a good way. Um, Other way of getting observership, use Google. Use Google, type in clinical attachments. You'll find few things, some of them for money. Um, mm, That's all about it. That's all about. I hope I did answer all the question is how to find an observership using Google Map. This way, I did use it myself, and it was successful. Good luck, and I hope you all the best always. Thank you. This is Mohammed. Thank you.